Hello, I'd like to welcome you to A Healthier You. I'm Larry Macon Jr., pastor at Mount Zion Oakwood Village, and I'm also a co-host on the show It's About You on WKYC Channel 3, where weekly I recognize people in the community that are doing some great things. However, this web series is about your health, especially during the pandemic. You know, as a leader in the community, I felt compelled to make sure that we get to you the latest information in all areas of health. And that's why I am very pleased to be partnering with university hospitals to spread the word in our community about how you can live a healthier life. Today, I'll be speaking to Dr. Donald Harvey. He's with the Department of Plastic Surgery at university hospitals. Welcome to the segment, Dr. Harvey.
Thank you very much. It's a pleasure to be here.
That's great. And so, Dr. Harvey, we're going to get right into it. So tell us what our topic is for today.
So our topic today is on breast reconstruction, specifically after breast cancer.
Okay, that's great. So I want to start with my first question for you. What is breast reconstruction? What is that?
So breast reconstruction is a series of surgeries. It's usually more than one. And what it is it allows a patient after breast cancer, usually has had some sort of surgery, either a partial or a complete mastectomy, where they've lost part of the breast. That can mean either part of the skin, part of the breast tissue, or the nipple. And what it is, it's a series of surgeries that allows us to reconstruct or return to more of a normal shape for the patient. We reconstruct the breast mounds, sometimes we reconstruct the breast skin, and sometimes the breast nipple. Just whatever is missing, we put it back for the patient.
Wow, that's amazing. So what does all that involve as a doctor? What all do you have to do to do that?
Yeah, so it's a lot of planning, and it's a lot of patient investments. The process takes about 6 to 12 months, and it's usually 2 surgeries at least, and sometimes there can be more surgeries depending on what the patient's end goals are and what's missing as a result of the breast cancer mastectomy surgery.
Mm-hmm. Is it only done because of breast cancer? Are there any other reasons that someone would do that?
That's a great question. We do breast reconstruction for a lot of different reasons. Breast cancer is probably the most common reason. However, we do breast reconstruction commonly for people who may have some sort of congenital, which means birth defect or abnormality between their breasts. Some patients may only develop one breast. We also do it for people who have trauma. Sometimes people do suffer really awful accidents that can leave them disfigured or deformed. And another reason would be for infections. Sometimes, which is pretty rare, but every now and then we do see someone who's had a bad infection and may leave them with some sort of breast deformity, either on one or both sides. And breast reconstruction is an opportunity to go through a couple surgeries, ideally one if we can, sometimes there's more, to restore that normal appearance of the breast.
Wow. So I guess that helps lead to my next question. Is this for everyone?
No, I don't think so. The breast reconstruction, although it's a very, very popular procedure, is not for everyone. There's a couple different categories I would think of for people who would want it and some people who don't. There are some people who they don't want to go through multiple surgeries. Whether if they've been through cancer and they don't want to go through more surgeries, that would be one category. Sometimes people aren't in the best health after cancer or after some sort of accident or infection. And in those patients, what we do is we delay the reconstruction, meaning we give them as much time as they need or they want to do reconstruction down the road. I would say, a lot of our patients, however, do want breast reconstruction as restoring to a more normal form sometimes help them get past the trauma of whether it's cancer or an accident or a birth defect. It kind of helps them heal not only physically but emotionally, and allows them to move forward with their lives.
Wow. So would you say that this type of surgery is for men and women?
It can be. So there are some people, men, who may have breast cancer or may have some sort of cancer or some sort of other trauma or infection that can leave the chest, upper chest deformed. And there are procedures we can do for both men and women. However, by and large, the largest number of our patients are women.
So what would you say to one of our viewers that is, kind of on the fence about this or thinks they need more information? Where should they do?
There's a couple things. There's always reaching out and talking with people that you may know have been through similar experiences. That's one option. The internet is another option. However, there's a lot of scary information, scary photos that sometimes can be misleading or turn people away.
Yeah.
I think by and large, the number one thing is to find a surgeon and come talk with them. I know me and my practice and several of my partners and several surgeons that I know all across the country, we are very passionate about helping people restore their body shape, and so they can feel better about themselves and move forward. And sometimes just a nice conversation of kind of seeing what's involved and what's ideal for each individual can really help people make the decision that's right for them and help them decide on the timing of when to move forward.
Well, I appreciate your time, Dr. Harvey, and I can really tell that you really care about your patients and care about, again, them kind of bouncing back in life from whatever situation they're in. So I want to thank you, Dr. Harvey, for all that you do.
Oh, you're very welcome. Thank you. And I do appreciate that. You know, the best part about being a plastic surgeon is helping people kind of restore that form, that shape. They feel better about themselves. And, you know, it's a sad day, but it's also a great day when they say bye and they don't need to come back and see us anymore.
That's a great day when they're all back together again. Well, that's our segment for this week to all of our viewers, but keep tuning in on social media as we continue to touch on topics and bring resources to the community. Contact me on social media or visit my website at larrymaconjr.com. Or for further information regarding your health or any concerns that you may have, make sure that you contact university hospitals and schedule a visit. Don't forget, great health, good health is wealth. And so thank you again for your knowledge, Dr. Harvey, and I'll see you soon.
Thank you very much. Bye-bye.
Bye-bye.